Hi, this is Dr. Victoria Andarcia. Thank you for joining me on the Healthful Roots podcast. Today I have Dr. Isabelle Amigues. She's a rheumatologist out of Denver, and I'm really excited to have you on the podcast. I feel like your approach to rheumatology is unique from what I've seen, and I am looking forward to getting your perspective today.
Yeah, thank you so much for having me, Dr. Andarcia. It's such a pleasure to be here.
Yes, well, for those of you that don't know, because I did look you up, I know that you're from France originally and you've done residency twice and then you came over here, you had to come over here and redo it. But can you tell us a little bit about yourself and your practice?
Yeah, absolutely. Well, such a pleasure. Thank you for asking. I went to medical school in France right after high school. So I was 17 or 18. I think it was like late 17 years old. And that's basically all I've done my whole life, just being a doctor or learning how to be a doctor. and uh, and I moved to the U.S. after finishing my residency and fellowship. So I was already a rheumatologist, and I had come to the U.S. to do a little bit of research, and I fell in love with the research world in the U.S. And so I came back. And because of the way it is, you have to repeat residency and fellowship. So I repeated residency in New York City and fellowship at Columbia University. And I have to say, like, I love what I do, and I've always loved like to you continue to learn so much. New York City was incredible. I saw some cases of leprosy and things that you don't see in a regular, definitely not in France, or it must be like once every 50 years. I learned so much, and I continue to learn, and I continue to learn even today. That is what medicine is about. It's just you're continuously learning. And then I moved to Denver, where I was at National Jewish. I was doing a lot of research, and I know we are going to talk about this, but in 2019 I had breast cancer that was metastatic to the liver and the bone, and that was a life-changing event, and it really allowed me to see medicine differently from I think I was already basically, because I was a physician, I approached my condition differently. And then because I became a patient, I approached my being a physician differently. So it's kind of like this virtuous circle, and all good. From my perspective, it was all good. And then we had COVID, and after COVID, I basically got a little not. I don't want to say that I was frustrated, because I wasn't, but I realized that I couldn't practice the same way. And so I basically decided to open my own practice that would take more time with patients, that would allow me to really go to the root of things, to really like go deep into what's going on with my patients. Why do they not reach remission? Like, how do we, like, basically, how, like, to offer the best of me and to look at the whole perspective of the patient. And that's why I called it Unabridged MD, because it was the non-edited version of the patient and the non-edited version of me. So then I opened this practice, 3 years ago now. And it's thriving. I love it. And the outcome that I get for the patient, I mean, it's not me, it's the patient. Like, the outcomes that we're getting for our patients is, remarkable. And I love it. I love what I do. I continue to do research. I'm not as involved in research as I used to be, just because I'm building this practice, but I'm definitely a researcher at heart. And I know that I'm going to continue to do research. And I would love to research more complementary medicine. I would like to research more holistic medicine, the power of what we call placebo, for example, because I used that as a physician. I used healing energy, and it's really hard to offer something to patients that's not well evidenced.
Mm-hmm.
As a patient, it's very easy. So sometimes I'll be like, okay, well, this is as a patient. I'm going to talk to you as a patient, and then go back to this is the physician perspective. Like, there are some studies on healing energy, but it's really not the greatest studies. That I think we have to be open to that, and I'm hopefully I have 50 more years of medicine in front of me, because I really love it. And I'm hoping that I can do research in that realm Qigong, Tai Chi, Reiki, things like that.
Ah, okay. I was going to ask you what you meant about healing energy. Yeah.
Well, yeah, exactly. It can just be prayers, right?
Yeah.
And as a physician, it's really hard to talk about that. As a patient, it's much easier. Um, and so, in a way, people are like, "Oh, I'm so sorry about your history of cancer diagnosis," and I'm like, "No, this is all great because I get this perspective and I get to share things that I've learned
Yeah.
and that have really changed my life and can change my patients' lives too." Yeah.
Okay. Well, I'm going to keep an eye out for your research because am a big proponent for energy medicine as well. I think it's very helpful, but you're right. It is something that's difficult to explain, and I wouldn't exactly like go running around the hallway telling my colleagues that I recommend it. So
Exactly.
I'll definitely look for that. Okay. Well, I'm really excited to get into all that. So one of my first questions is like in the rise in rheumatological disease. I mean, we're seeing a rise in everything, right? Rise in cancer rates. There's a rise in rheumatological disease. So I just wanted to know from your perspective, what do you think is driving this increase?
Yeah, it's such a good question. So and this is going to be a very scientific response, right? Number one, I think we are able to diagnose them a lot better. So we can diagnose rheumatologic disorder a lot better than we used to. So that's number one. Number two, there is a COVID infection that really triggered the immune system
Mhm.
of people. And so a lot of them actually developed a rheumatologic disorder, and it's well researched, well proven that COVID triggered a lot of rheumatologic disorders afterwards. So we see a lot more rheumatoid arthritis, spondylarthritis, spondylarthropathy. There's actually a lot of inflammatory bowel disease as well that was triggered by that. Whether or not those would have happened anyway in the future with different type of infection or stress, we don't know. We don't know if it's just one time and just like everyone that could have gotten something developed it after COVID, um, or it's just COVID did actually do that. Do you know what I'm like? Am I
Yeah.
clear about this? Yeah. Mm.
Okay. And, sometimes diseases can take years to diagnose. So, what are the biggest challenges do you think in recognizing that that's what's happening?
Mm. Oh, you're asking me to to share how I make a diagnosis. Um, all right. So I think to answer this question, I think I'm going to just share how I approach rheumatologic disorders. Right. Um, so the first thing is, to me, the body is in equilibrium, so we're in balance. So I'm sure we're gonna be very similar in that. So I think the body is in balance, and then our immune system is constantly working for us. And I really do
Mhm.
believe that. I believe that even when it's not working perfectly, it's trying really hard to work for us, and we need to guide sometimes the response that it has. And so sometimes our immune system is recognizing some elements inside of our body that are actually our own body. And it's recognizing this as something that shouldn't be there and creating an inflammatory response. And that inflammatory response can basically lead to those autoimmune disorders such as rheumatoid arthritis, lupus, Sjogren, mixed connective tissue disorder, and there are so many rheumatologic disorders, right? But in general, a rheumatologic disorder is an inflammatory process and an autoimmune reaction that's basically trying to get rid of something inside of our body and causing inflammation, because that's the way that we get rid of things that
Mhm.
shouldn't be there. And basically, uh, our my job as a rheumatologist is to figure out what type of process it is. Is it an just purely inflammatory process such as gout or pseudo gout,
Mhm.
or is it autoimmune, or is it auto-inflammatory? Like an auto-inflammatory would be like if you have fever of unknown origin and you develop Still's disease or juvenile arthritis, that's more an autoinflammatory syndrome, and usually there is no antibody associated with that. That's when
Mhm.
it's really hard to diagnose. But you have ways to figure that out. So you can, if someone has cyclic, so that their symptoms keep repeating and kind of like similar
Yeah.
symptoms, that's like autoinflammatory. Those are the ones that are the hardest to diagnose because there's no test for that, or very little test. And then there's the rheumatologic disorder. That was my cat. I'm sorry, cat. I'm so sorry about that.
That's okay.
So yeah, and then there are the rheumatologic disorders such as rheumatoid arthritis, lupus, psoriatic arthritis, and so on. And those are inflammatory, and those they basically the way that they're going to you know they're going to present is different than those other one, the purely inflammatory and the purely auto-inflammatory, because you're going to have some certain type of joint pain with inflammation of the joint. You're going to have like skin rashes if it's psoriatic arthritis. You're going to have like some certain type of rash, some like hair loss, and
Mm.
so on. And so we have criteria to say, okay, this is more lupus, this is more rheumatoid arthritis, this is more psoriatic arthritis. And we have criteria that are here. Actually, like there are some diagnostic criteria, but mostly there are classification criteria that we use to put our patients in clinical trials. And I think that that's where the art of becoming a rheumatologist comes in, because we have to remember that not every patient reads textbook, right? Like the
Yeah.
body of our patients are not reading textbook. And so not everything is textbook. If it was all textbook, we wouldn't need a rheumatology. We wouldn't need like so many years of training. And so we just have to like go back to the basic of what does this looks like? And what do I think this is? Like, is this lupus like?
Mm.
Is this lupus? Sorry, my cat is moving. Is it lupus like? Is it more like rheumatoid arthritis, etc.?
Okay. Well, thank you for that. That's very detailed. I want to kind of switch gears into, do you need to get your cat?
Yeah.
Okay.
Will you be
It's
able
okay.
to
I
listen
can
to
edit
this?
this. It's fine.
Okay, cool. I'm gonna put him outside because he's say hi and bye.
Hello.
Yeah, it's okay. Thank you. You are getting outside. Sorry. Normally is not as naughty.
No, it's okay.
Normally is not
Um,
as naughty, but I don't know what. Like I was on vacation, maybe that's why before. So
Maybe, yeah.
it's like,
He wants to
okay,
be with you all the time now.
yeah,
Okay.
yeah. Sorry
Um,
about that.
no worries.
So I responded to the question of,
Yes.
okay,
Yeah. Okay. All right. So now that we are, kind of getting a little bit deeper into rheumatological diseases, I did want to touch on your TEDx talk, which I will link so everybody can watch it. I think everybody should watch it. But like I was telling you before we started the show, it definitely switched a perspective in me that will help me with my patients. And that when someone gets an illness or a disease, we're talking about, you got to fight it, you're going to slay it. And it's, a little bit, while it's meant to empower the patient, it can be negative as well, because it's almost like you have to fight yourself, is how you described it. So I wanted you to kind of expand on that and how you help your patients shift their perspective.
yeah, absolutely. Well, so well, I guess I don't know. I guess it's a twofold question here. The first one is related to my own story with this stage 4 cancer diagnosis. I really like using, instead of dis-ease, I like using the word condition. And
Mm,
right, like dis-ease, you're separating yourself and you're saying that there's something wrong. And condition is something that you have to work with.
mm,
So when you have, and I'm a mom, and there's a lot of explanation that I use as a mom. When you have a kid that is not doing what you want them to do, or that's doing something wrong, and you know that doesn't help them, right? We're not going to fight the kid, because if you fight the kid, they're going to either shut off or they would actually like double down on being more upsetting, right? And I'm not perfect, by the way, as a mom, but definitely not. And it's not necessarily easy, but I do know that in theory, this is how I should address my kids if I were fully, fully not tired and a ton of patience. I would definitely do that, right? All the time. Doesn't happen all the time. And with my body, it's the same. Sometimes I'm like, okay, come on,
Yeah.
be better. um, but like in all theory and in, I try to aim for this as a mom, and I try to aim for this also as a patient and as a physician, which is looking at our bodies as a vessel that's really there to help us. And instead of looking at our bodies as enemies, looking at them as friends. And when you start looking at that, you're actually much more willing to listen and to be good with them, and to maybe push them also a little bit and say, hey, you can do this. Like, I know you can do that. Like if it's a workout or things like that, right? Like, how much can I push you? But at the same time, I want to be careful about not breaking you. So that's,
Right.
something that we can all, look at. And so from there, as as a so when I got diagnosed, it was very scary because it was stage 4. It had gone very fast. I had not seen anything, right? Like, so it was very aggressive. And I could have said, oh, my body failed me, right? And I decided that this would not help me. And that if I were to be in this idea of my body failed me, I would actually be angry and I would be in this negative position towards my body, towards life, towards me. And I decided that I was going to take it all in and just basically started thinking, what does my body need? Like, how can I nurture my body? What do I need? And that actually kind of overflew to, what does this condition need to go? What do I need to do to let it go? What can I learn from this condition? And so it's someone that had told me, like, don't see this disease as an enemy, see it as a friend that's here to go, to teach you something, and then we'll go. And it's so much nicer to think that way than to think of an enemy that's constantly living with you and trying to kill you. I mean, if you have those two options, I would much rather think that that cancer was a friend that was there to teach me something and was going to go away. And you know what? I'm very scientific, right? A very evidence-based medicine. But when it came to taking care of my own self, it was a no-brainer for me that living with a friend was way better than living with an enemy. And from there, I realized that sharing that perspective with my patients really could change their lives, right? So when, like, I had done this already, when I had asked patients, like, can you think of anything that this disease, this condition has brought to you? I had already asked that question to several patients before my own diagnosis. And so then I think I kind of like used what I had told my patients towards me.
Mm.
And sometimes I do that actually. Sometimes when I have a PET scan, just to make sure everything is good, I always have to be like, hey, hold on. Like, this is really just like, I think of, I have to reassure the patient me by the physician me. It's actually really kind of cool because I'm like,
Oh.
Isabelle, this is why we're doing this PET scan. It doesn't mean anything. If we find something, we'll do something. Don't worry. And it's funny because I'm like, oh, this is a physician mind reassuring the patient's mind. And so, yeah, that's kind of like the same thing from a patient perspective, like from a physician perspective. Sharing this view to my patients is to basically say, look, your body has not failed you. Your body is talking to you and is
Hmm.
telling you that there is something that you need to do that's different. And when we have young patients, uh, I had a patient that was very young. She was 17, and I took care of her. And it was not rheumatologic. I diagnosed her with type 1 diabetes. And I remember telling her, look, yeah, you can see this as um, it's really unfair. You're unlucky, or you can think of it as, I'm really lucky I live in a world where, continuous glucose monitoring is here, insulin pump is here, I don't have to do as much as we used to, my quality of life is not going to change, because we have so many options now to take care of this. And also, as I'm when after the TEDx, a group of us, we were like 20, 25 or 30, we actually all shared like the something that those TEDx talks had taught us. And one person had type 1 diabetes, and she said, I'm actually grateful, and I've always been grateful for my type 1 diabetes, because I get to understand what's going on into my body. And so I shared this with this patient. I said, you can see it like this person is seeing it, right? And she considers that this is actually a gift for her. She takes care of her body much more than she would have if she didn't have type 1 diabetes, because for her, it gives her a window of what's going on with her body. And so she is like this really strong athlete, incredible rock climber, has a totally normal life. And actually, she has like a better life than most people, because she's taking such good care of her body, right? and
Mm.
so and so then you have this pathway forward, and instead of being angry, instead of being beaten up, instead of feeling sad for yourself, you're actually seeing this as a superpower, as a, oh well, now I get to know when I'm doing too much because I get some joint pain. I get to know that I haven't eaten as well as I should have, because I get, some abdominal pain, or like some diarrhea, or, whatever, bloating.
Yeah.
And so then instead of being upset, you're like, no, I get this window of what's needed for my body, the same way that I would look at my kids and see, are they crashing? Are they acting up? And, it's sort of like just looking at it from this perspective of caring and love. And I would say that in general for life, this is all much better. To just look at it from a perspective of love is just, everything is so much better when you look at that from there. Yeah.
Yeah, I agree. And it seems more empowering too for the patient. Um,
Yeah, I think that that's actually that's like the biggest thing for me, because I like now I look like I'm talking like all love and all this, but I've always been a fighter in the past. I would always fight everything, and it's really interesting because you don't have to. Like, I've changed my way of living, and I'm much more in a, like, I'll choose love over everything. And it sounds so weird. Like, and it sounds so, what's the word? But it sounds, uh, we say cucul la praline in French. I don't even know how it's in English, but it's like, it sounds like a little silly and a little
yeah.
childish to say, "Oh, I choose love." But if you really go deep, when I mean, I faced death, I really like wasn't sure I would make it. My kids were 3 years old, and I remember I was like, well, I don't want to fight for the rest of my life. That's not what I want to do. And I want to love, and I want to be loved, and I want to feel loved, and I want to feel like I love. And that changed everything, because suddenly you're like, I'm not fighting. Like, this is not about a fight. This is about what matters to me. Like, how do I want to surround myself? Like, who do I want to surround myself with? And I think that that's the same thing when it comes to a condition. Like, right? Like, if that condition allows our patients to pause and to say, what's happening to me? What can I give my body? Like, what does my body need? Like, do I need a break? Like, what's happening?
Mm.
What do I need? And suddenly realizing that we have never thought of ourselves. We've never, and especially women, right? We're always constantly looking at other ones around us, not realizing that we need to take care of ourselves. And our body suddenly is saying, hey, sorry, you can't do this. You're going to have joint pain, you're going to have a rash, whatever, like whatever it is. And suddenly being like, okay, what does my body need? Like, I'm going to take care of my body and my
Yeah.
mind, like, because they all get together, right? That is empowering. And it's not only is it empowering, but it can change your life for the better, because suddenly you're taking a pause, and you're taking, like, you're not reacting, you're actually living. Yeah.
Yeah, no, that makes sense. Okay, so then I'll ask you this then, because you're talking about how important having this shift in perspective can help the individual feel empowered. So, would we say then that like negative emotions or stress can trigger or worsen an autoimmune flare or condition? You know?
I mean, I don't have to say it, my patients can say it. So I will say personally, for me, I was in my pure midlife crisis. So when this happened, I thought it was, I remember I was like, I'm already doing my midlife crisis. Why do I have cancer? Like, this is ridiculous. I was so mad. Like, my first reaction was like, no, I don't have time for this. I'm already
Yeah.
dealing with midlife crisis. And then I was like, well, I guess it's over. I guess my midlife crisis is over because now I have to deal with this because life happens.
Hmm.
Um, and patients say it all of the time. They say, I'm very stressed and I've got a flare. I don't have to say it. It would be, we all know that this is real. Like heart attack happens after a stress. White, like people turning white, like their hair turning all white after stress. We all know that the body keeps the score, right? Like we all know that. And so, um, to me it's really important. I think that there is some work, I'm sure actually there's some work, somatic release and things like that I find fascinating personally. But yeah, our bodies keep the score, and so I think it's our job to make sure that we talk to our bodies and our mind and be like, okay, what do you need? Like, you went through something really tough. This is very stressful right now. Like me, who's so go 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 and type A personality, now when I feel stress, I take 5 minutes to meditate. Like I oblige myself to meditate, and I start meditating. I put a video on to meditate, and I'm like, no, not going there again. Meditate. And it changes everything, because then you meditate and then you realize, like, okay, I can deal with this. It's fine. I can deal with whatever happens because it's
Yeah.
life and it's okay. Um, and yeah, stress definitely can. So I think, stress can affect our bodies and our mind 100%. And I think what we forget to say is that taking care of the stress, preventing how we react to stress, can
Hmm.
also do a lot of good for us. And so, right when I'm talking about like, oh, I'm stressed, and I'll feel it. I'll be like, oh, and so yeah, yesterday I came back from vacation, and it was 8 hours drive, and I was like the only driver. I put some meditation music because I was like, well, I'm getting really stressed by this long drive. I'm gonna just put meditation music, and that's to me, that's my way of just relaxing. I think some other people it might be exercise, some other people it's seeing friends, some other people it's eating a very good meal. As long as you take enough time to relax. Sorry, I'm always trying to find solution. I think that's the physician in me,
Yeah.
and. Uh, and I think it's really hard to say, oh, don't be as stressed. And I think uh, it's hard. Like if you are dealing with your parents that are sick, that's not easy. If you're dealing with one of your kids that's not doing so well, or if you've been laid off, or whatever. There's so much stressors in life. Also, the news. I'm
Yeah.
or like I don't listen to the news, but they come on my social media feeds, and I realize I'm like, why am I looking at those? Like, why am I looking at my social media? I would rather read, and I would rather listen to meditation stuff, or like just a relaxing person. And I think that that's just the time to say, okay, yeah, I am stressed. There are stressors in life, and I am going to take the time for me to relax. Does that make sense?
Yeah, no, it does make sense. But I think, as far from what I've seen, because I agree with everything you've said, it's almost something that you have to connect for some people, or just like meditation is part of the things that I'll recommend for my patients. And then they'll be like, oh my gosh, that helps so much. But I think that we get so used to being on autopilot. Like you said, I was type A too, and just on the go, 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 that it's almost like slowing down and taking the time.
Hmm.
Probably, I don't know for you, but like it didn't feel good at first, right? I would try to slow down and I'd be like, oh man, but I have so much stuff to do.
Yeah.
So it's like a learned thing that you have to learn. But I loved that book, when the body keeps score. And I just listened or read Gabor Mate. It was When the Body Says No. And it was so good. But it's also just like, yes, you have to slow down, or at one point your body will tell you that it's time.
Yeah, that, like, since we're books, I mean, I read so much and I love reading. One that's really good, especially for women, I feel, or for people who don't say no enough. It's Essentialism. Uh, Essentialism, yeah. I think his first name is Greg Erwan. But yeah, one of the best book I've ever read, because it's about explaining how saying no is actually saying yes to something else. Every time you say yes,
Mm.
you're actually saying no to something else. And what you just said, which is, oh my goodness, there's all those things that I'm not doing if I'm meditating. And you're like, well, yes. And because you're meditating, you're actually saying yes to your body and your mind and your sanity. And in the long run, this actually helps you.
Yeah.
And I think that that's basically where I have to explain to patients, like, yes, you're saying yes to this medication and it's scary, but look. And I think that that's our job as physician, to show our patient what's there, right? Like, what's happening. Like, if you do this, this is, as a physician, as a rheumatologist, based on the evidence-based medicine that I know, based on the science and based on my own experience, this is where you're going. You're going into remission, right? If
Hmm.
you're taking time to meditate, you may not need as much medication. And to
Yeah.
me, that's where I agree with you. I think it's convincing. It's showing. It's this guide piece, right? Like, it's the patient that does the work, and we are here to guide them. And I think, yeah, you're absolutely right that at first it may not be obvious.
Yeah, exactly. And so, talking about treatment, I wanted to ask you, because I mean, I know that with rheumatology, sometimes medications are required, but what other alternative therapies, or what other things that may be different than the traditional model, do you incorporate into your treatment plans?
Oh, I totally do, because I think it's super empowering to think that your diet is helping your body, to think that, and to see, not only to think but to actually experience it. It's super hard to do studies on diet, by the way. So the diet studies are not the greatest. However, we have some good ones in rheumatology, and we know that it really makes a difference. And it's very interesting to me that 20 years ago, we used to say, no, it doesn't make a difference. And our patients were like, no, but it does. And you're like, and I remember, like, super clearly, I was like, a patient is always right. If a patient experiences something, they are right. There is no question about that. And we shouldn't, like, it was like the white man kind of like syndrome, like chief syndrome. No, they're wrong. And then you're like, well, 25 years later, we proved to you that the patient was right.
Yeah.
It's really funny. Anyway, so diet is a big one, and whole food plant-based diet is what I recommend. And I recommend 80%, because if you're going to stress yourself into it, it's not going to be great either. But 80%, I think, is totally doable. 80% whole food plant-based, and then sometimes you have the 20% when you're not going to eat whole food plant-based, and that's totally fine. And then, yeah, meditation, visualization. Some patients love affirmations. I do recommend that. I recommend also, uh, you know, like anything that's going to stimulate your parasympathetic system. So, like, singing, humming,
Mm.
cold plunge. I'm not a big fan, but I know that they work, and some of my patients love them. That's really good. Infrared light therapy for some of my patients, they love it. I think the biggest one, the biggest one is diet, like nutrition choices, and then meditation. To me, those are like the biggest one, the ones that I see the most result with. And it's funny. So he's not my patient; he's a friend of mine, and he has psoriatic arthritis. It's so obvious. Like, he has typical psoriatic arthritis. And what's fascinating to me is that he just deals with it with a diet. That's all he
Mm.
does. And it's so like, as a rheumatologist, I would never see those patients because they don't come, because they deal with it with their, nutrition. And seeing his like flare up, and then he'd be like, oh, I haven't been good. I've been very stressed. And he'll take some anti-inflammatory and it helps. And then he goes back onto this very good nutrition choice, and then it's all gone. That's, to me, is super, like, it's fascinating to me, right? Because it's like, oh wow, like here is someone that has something that if he had come to me as a patient, I would put him on medication, and
Yeah.
he doesn't need it. So, that's another argument to say, yeah, not everyone is going to need a medication. Now, to me, as a rheumatologist, I'm like, why not take a medication if that medication can just be helping the body, right? Our
Hmm.
medication are so good. So, I'm totally game to try nutrition and meditation and all of those things for a little while, but I don't want it to be to the expense of the bodies of our patients. And so to me, it's like after a month or two, if you haven't seen perfection, then let's use the medication, because starting a medication, you can always back off. But getting our patients to remission, to me, is the priority number one, to get this as fast as possible so we don't sustain damage.
I was going to say that because probably the sooner that you start for some conditions, then you can avoid permanent damage. So
Yeah.
just want to clear that
Yeah.
five for anybody who's listening.
So there's
Uh,
that. And then the other thing is that the sooner you get to remission, the faster you can get off of those medications. Right? So the
right.
goal is full remission and then backing off from medication to the least amount that you need. And some patients don't need anything. So to me, that's a big one. And that
Yeah.
friend, by the way, got into remission with NSAID, which technically is an anti-inflammatory. Like it is one of those medications, right? So I was
That's
like,
interesting.
hey, you've got to try, like, at least take the NSAID, and he did, and he was like, wow, this works so well. I'm like, yeah, welcome to the world of rheumatology.
Yeah, that's interesting. Like with dissonance said. Okay. And
Mhm.
do you think that I think rheumatology is the perfect field for this, but do you think that we're moving towards a more integrative model in general? I mean, because I know you do research on this, and there have been studies that talk about stress and autoimmune and diet and autoimmune. So do you think that we're getting to a place where there's going to be more of a holistic approach?
Yeah, I think so. I think that there's more and more studies on that in cancer research, in rheumatology research. Absolutely. Cleveland Clinic does a lot of work on this. The NIH and even Sloan Kettering, they have integrative work. They do research
Yeah.
in those areas. So definitely, it's happening. I think it's harder to research, but it's definitely something we are researching. The NIH has grants for those. Yeah.
Yeah, and I think that with that, our model is going to have to change because, like
Yeah.
we were talking before, I remember doing my rheumatology rotation when I was an internal medicine resident, and it was like a factory. People are in and out, like in and out, in and out, and you really didn't have a lot of time to focus on, what's actually going on with the patient. So either we're going to have to bring in a lot more people, like nutritionists and therapists or health coaches, or the doctor is going to have more time with their patients.
Yeah. Yeah. And I agree with you. I think also the model that we have right now in medicine, I think it's dividing. It's like we're dividing in two, and it's going to be the insurance model and the direct care model. Where the direct care model will be where physicians are actually taking their time and doing the right work. And when you're
Yeah.
looking at the direct care model, it's pretty much what it used to be before, where we have just
Yeah.
gone back full circle to the way physicians used to practice medicine. I want to say 40, 50 years ago, maybe less. Yeah.
Yeah. No, I
We're going
agree.
back to
Oh,
that. Mm.
yeah, no, it's definitely more fulfilling and it's better for both parties. I definitely
Yeah.
agree. All
There are
right. So
studies on that. I think that that's what's really cool, is that there are studies on that, specifically how the outcomes of patients do way better if they have a good relationship with their physician. And there's only
oh,
one way to have a good relationship with your physician, is to have the same physician over and over again and have time with your physician. If you don't have that report, you're not going to have it. Like your outcome is actually going to be less good. It's a Harvard study. It's a very well done study.
Oh, I
Uh,
haven't read that
and
one. I'm gonna have to look for it.
yeah, I think I had done a episode on that. Yeah, it's really well done. Um,
Okay.
and yeah, and then what did they show that women had a better outcome for their like woman physician, the patients who have woman physician as medicine, like in internal medicine, have better outcome. And then they did the same thing with surgeon, and they found the same thing. And
That one I read. Yeah.
yeah, and I think that that's actually interesting because it's not, I don't think it's related to being a woman or not a woman. I really don't think so. I think just women take a little bit more time. A
Hmm.
lot of women are actually not full time. And I think it's because we take more time because we know that otherwise we would be totally depleted. And so, yeah, it's not factory like woman, like we cannot do that, right?
No.
It's not in our
No,
books.
I tried. It was too much. It was too much for me.
Yeah.
Yeah. All
Yeah.
right. So before we wrap this up, I just wanted to ask you, what's one misconception about like rheumatology or just autoimmune in general that you wish more patients understood? Like, is there something that people come to you all the time and you're like, no, that's not right. Like, this is how you should see
Yeah.
this.
Well, I'm sure there's a ton, but like the most recent one is a patient that told me, "Oh, I really hope I don't have a rheumatologic disorder. That will be the death of me." And I'm like, no, there is so
Yeah.
many treatments now that having a rheumatologic disorder is probably, to me, is wonderful because we have way to treat it. So if
Hmm.
it's an inflammatory arthritis, we can get our patients to remission. So to me, that's a misconception to think that having a rheumatologic disorder is the death of them, right? Like, or
Yeah.
something that's terrible. I'm like, no, we have treatment. We got you. We got you.
Okay. All right. And for anybody who's listening who's like, I want more information, um, how can people get in touch with you, or how can they find out more information?
Yeah, well, thank you so much for that. So I'm on all social media at unabridged MD, so unabridged MD, and then my practice you can actually look into it at unabridgedmd.com, all social media under that. And then I just created a website for positive ANA. I'm super excited about
Mm.
it because it was, everyone comes and they're like, I have a positive ANA, I have an autoimmune disorder, and you're like, not everyone with positive ANA have something, and not everyone that have something have a positive ANA. And so it's a website that's going to be like where there's going to be like people that I interview about, like rheumatologists that I interview, researcher that I interview. And there's a ton of information, and that's called positiveana.com. And yeah, I would love for you to share that because I know that
Yeah.
a lot of physicians order an ANA and then they don't have the time or they don't have the expertise to respond to the
Yeah.
question of our patient. So it's www.positiveana.com. I mean, that's
Yeah.
easy. Positiveana.com. And I think
I'll add
everyone
that. I
gets
saw that
that.
on your Instagram and I'm like, this is perfect. I'm
Yeah.
going to be honest. I see a positive NA and I'm like, you got to go talk to a rheumatologist because
Mhm.
that's like where things end for me.
Yeah, and that's some like that would be helpful actually to share this because there's like I've already shared like how I address positive ANA, and there's a lot of education about that. So I think the most important thing is to empower people, empower patients, and education is so important.
Yeah.
And the education that comes from a reliable source, right? Like instead of going on internet and freaking out about a positive ANA, go to that positive ANA, yeah, and it's fully like it's positiveana.com.
Yeah.
And it really allows to have a lot more answers that come from a rheumatologist that deals with that all of the time. So yeah, and again, it's gonna be I'm interviewing people as right now about different diseases that conditions, sorry, that have this positive ANA.
Yeah,
Yeah.
great. Well, thank you. I will definitely share that and I'll send an email out with the information. And I just want to thank you so much for your time. I loved our conversation and I just really appreciate you being here today.
Thank you so much for having me. It's been a pleasure. Thank you for your
Yes,
questions.
thank you.